The way we did the calculations, as I will share earlier, is that first we looked at information that we already had in terms of per capita costs expenditures for the different technologies, because IRC had already done a number of LCCA assessments. So we tried to look at this data and then compared it with the data that was being generated at national level through a strategic sector investment plan, to avoid another exercise of really going down to get these kind of actual costs. Then for sanitation, similarly, we used a similar approach. Try to look at targets, 2021, 2030 targets, and also trying to have that balance. And as I mentioned, we try to see how the population moves up the ladder. And because of the planning that is already there in the town, in the small towns, in the district, you see that safely managed targets are really low. For 2021, the entire district is looking at 5.9, basic is at 48%. 2030, you also see safely managed is at 28, and basic is at 72%. So in terms of the strategic actions, I'll just concentrate on two of them. One is the public-private CSO partnerships to mobilize capital investments. One of the biggest requirements, as much as we say infrastructure is not the end, but infrastructure is really important if you're going to reach everyone. So one of the strategies we adopted here was see how do civil society organizations, NGOs, partner with government to mobilize for resources together. We had some lessons from Water for People that was also working with the districts, asking the district to bring a certain percentage and they top up a percentage so they can work jointly together. So we also worked with the district and the utility, which is National Water and Sewage Corporation, worked out a partnership to also mobilize money to actually go in infrastructure, because we realize this is an important case. And this experience is one of the first in Uganda where you have a national utility, an NGO, and a district coming together to work on a pipe network. Then the other, in relation to operation and maintenance, we had collected a lot of evidence for a number of different models. So one of the models wanted to study and pilot was a model called pay as you fetch model, which we'll be sharing later in this presentation. Because the district in Karabole had identified this as one of the models they wanted to scale up. So they adopted it as a strategy here, but then also through the work we're doing under the USAID SWS project, we took it on as something to study a little bit more and see what is it that is working, what is it that is not working, to inform this whole master planning process. For sanitation, one interesting thing that we picked up was a campaign called Start With Your Leader campaign. And this campaign is just about starting with the local council leaders themselves to have improved toilets, so that they would be the champions for the campaigns at that level. And it was a very successful campaign in one of the sub-counties. I don't know how many toilets we managed to.
Over 200 in 6 months.
I think over 200 in 6 months, yeah. So it was really an intense campaign that we tried to focus on, like as an example to start with, but also to really adopt it in the plan and see how we can scale it up. So in terms of costing the plan, we use the life cycle costing approach to look at the capital investments, capital maintenance, direct support, capital investments, capital maintenance expenditure, direct support. The operation and maintenance expenditure doesn't appear here because these are the routine maintenance expenditures, so we didn't capture them in these projections here. So, like I said, when we're looking at capital costs, we mainly looked at the per capita investment costs. Look at per capita investment costs, but we took into account the existing population projection, the technologies needed for wash service delivery, and then the issue around maintenance in the long run. And then for direct support, one of the challenges we had in the past when we were coming up with these costs is that we tried to map which different development partners were in the districts, how much money they were bringing in, and then we tried to cost the technical support that these organizations were bringing to the district, and then tried to kind of extrapolate it. But it's a methodology that was not comfortable with the district people, because you have different organizations, they have staff, they pay at different levels, doing different things, and looking at this as money that has come into the district to provide support, there was a lot of contention around that. So we used some data that we had collected as IRC from the life cycle cost, and also existing data that was there in Karabole to try to come up with a projection on what that would cost. So in terms of the costing for water, it's about $24 million that we came up with as the required investment by 2030. And for sanitation, about $48 million. As you can see there, then these are the breakdown of the different cost categories. So in terms of the next steps, one is that we need to break down this plan into 3 to 5 year operational plans. The district is going through a process of developing 5-year operation plans that speak to the 20-year plan of the of the government of Uganda. So this is an ongoing process. We're trying to see how we break down those plans so that the lower local governments can see their place in these plans. They can come up with some tangible areas to concentrate on. And along the way, we're trying to work with the political leadership to legislate the budget allocation for WASH at the lower local governments. At the moment, lower local governments are not putting in any money for WASH. So we are trying to come up with that legislation so that at least they can put in some money. They are starting from a very low level. It's about 4 to 6 million Uganda shillings, which is slightly over $2,000. But at least we want to start from there and see how do we move. So that each lower local government makes a contribution. Then the other is documenting the process. Documenting the process so that we can influence long-term planning at national level. Then adapting lessons from some of the models we've tested as part of the process, like the pay-as-you-fetch. Then some work around water quality monitoring that we'll be sharing with you as part of this presentation. So thank you very much for listening.